good afternoon, and you're welcome.
Good afternoon.
You seem to be a little bit under the weather, is it?
A bit of a cold.
Yes, this is the weather, I'm sure. The weather is quite cool.
Well, yeah, the children.
Anyways, you're welcome.
Yeah.
And I hope everything is well.
By
you had
God's
a great
grace.
weekend.
Not too great because of the cold.
Yeah, I also had a running tummy. Actually started on Friday. I brought it to work and it continued till this morning. This morning I took collodium. I couldn't bring it to work anymore. I don't know. I mean, I usually don't like to take medication when I'm running, but I didn't know how I was going to go through today because it was getting worse.
Oh, okay.
Is
Is it for a topic?
Is it advisable?
Yeah, it's actually very good to avoid taking antibiotics. Usually it's viral or maybe a reaction to pepper or something in the food, and it's self-limiting. It goes away by itself.
Yeah, usually that's what I want to do, but it's been 3 days. I don't know. It's not getting better. Anyway, so we'll talk about that later on, and then next time I'll do the right thing. But today we have an interesting topic to discuss. I don't know about this. It's cellulitis.
Yes, cellulitis.
Do you know of a local name for it? Because I've been trying to find out. Do you know any local name for it?
Honestly, no.
Okay. I'm sure by the time we go through it, we would know.
Yeah, maybe the listeners can help us
Yeah,
out.
I mean, if you're listening, and then you get to hear the description and you have a local name, there's a local name for it. Don't forget to send us a message on it, 0505751151. You can also send us any question that you have on what we're going to discuss today, or subsequently we'll be going through them as well. You can join us on our live stream on Facebook, PLUZZ 899 FM, as we go through cellulitis today on Hello Doc. So, Doc, let's talk about it. What is cellulitis?
Yes, cellulitis is the name we give to an infection, a bacterial infection of the skin and the tissue just beneath the skin. Okay. Yeah. So we can just say more of a skin, the lower layers of the skin. Yeah. So when there's a bacterial infection in there, then that is what we call cellulitis.
Okay. Yeah. Is it generic, like or is specific? Like, okay, so I know we probably would have several skin infections, right? But is it generic for all bacterial infection of the skin?
So it's a general name for infection of the skin and then the underlying tissue, any part of the body. Skin covers the whole body.
Yeah.
So wherever there is an infection. So usually it occurs in the lower extremities, the feet. Most people get the cellulitis in their feet, toes, legs, but sometimes you can get it on your hands. You can actually get it anywhere there's skin, you can get that infection. Okay,
all right. So tell us the common symptoms of cellulitis.
Okay, so it's very the first thing is usually pain. So you feel pain in a localized area. Sometimes you feel pain maybe in your thumb or in the part of the palm or a toe or a part of the leg. So there's pain. Then it goes forward to become tenderness. Tenderness is pain when you touch that area. So sometimes you might not be feeling it as painful, but when someone touches it, then you feel the pain. That's what we call tenderness. Then there's swelling, and then that area becomes warm to touch. Sometimes you may see skin changes, especially those with lighter skin, fairer skin. You see the color changing to orange, reddish, thereabouts. Then if it goes further, then it forms blisters. Not necessarily a boil, but like just when you get burnt, that thin layer in the fluid. So that's what happens. And then if it goes further and the infection goes into the bloodstream, then we have the non-specific, what we call non-specific symptoms: fever, chills, fatigue, headache. So you feel very ill, but you're not really sure. That's why people always say they have malaria.
I was going to say that's why they say when you have these symptoms, don't go taking medication, because it could be because of cellulitis, but you're feeling fever and you're thinking you have malaria, and so you go for malaria medication. But what causes it?
It's a bacterial infection that enters through a break in the skin. So the break in the skin could be from, maybe if you have a skin condition, maybe eczema, the skin has become very, should I say, crusty, or very dry, so it easily breaks, or maybe a prick, a thorn, maybe you scratch too hard, maybe in the kitchen you were cutting or something. Anything that breaks the skin layer and it opens it up for an infection to get in there.
Okay. Is it communicable?
No, it's not communicable.
Okay. All right.
You can't give it to someone that way. No.
Okay. All right. That's good to know. How do you diagnose cellulitis?
Well, it's basically from a clinical point of view, as in from the signs and symptoms. Okay, so if maybe they have a history of pain, swelling, so it's like a sore. So when you see, you know that is it. It's fairly obvious once you see where the area that's affected.
What's the experience? Do people normally get cellulitis and tend to self-medication, or they take it to the hospital? What's the experience?
Most people tend to they tend to actually ignore it until the infection becomes more severe. So they tend to come to hospital when it has formed blisters and the leg is very swollen and very painful. They can't walk. That's when they end up coming to the hospital.
Okay. All right. But walk us through the treatment options available for cellulitis.
Cellulitis is bacterial, so we need antibiotics.
Okay.
So usually you take the antibiotics a minimum of 7 days, but you can exceed the 7 days depending on the severity of the infection. So we don't advise you to be taking your own antibiotics by yourself, because a lot of times people don't know how to prescribe or how to take the antibiotic. They don't know the correct number of days, the correct dosage. Even when you go to the pharmacy, a lot of times they will misprescribe the medications, and it leads to antibiotic resistance. So now the common drugs that are supposed to be able to kill this common bacteria, the bacteria has developed a strength against it. So now we have to go for the more expensive, higher level antibiotics.
Okay. But you said usually the treatment will take up to 7 days? Usually
minimum of 7 days.
Okay, minimum of 7 days, but it could be extended. Are there any potential complications from cellulitis?
Yes. So once the infection enters the bloodstream, then the bloodstream, the bacteremia, that's the bacteria in the bloodstream itself, can cause what we call sepsis, and it can lead to a very dangerous, life-threatening syndrome called toxic shock syndrome. There could be, from the blood, it could seed the bacteria to other organs. The most dangerous is endocarditis, when the infection, the bacteria goes and lands in the heart. It can also go into the bone, and that's where we get osteomyelitis. Usually that occurs with the children. And then sometimes people might get recurrent episodes of cellulitis, especially those with low immunity, like those with diabetes, those with HIV. Sometimes maybe some TB patients as well. So patients who have a low immunity tend to get these recurrent ones. And when they get recurrent infections, there's a blockage in the lymphatic system. I don't want to give you too much. But
No.
It can cause swelling, like a more permanent swelling in the legs especially.
Okay. I mean, it's interesting, a skin disease or a skin infection, but then if it gets into the bloodstream, it could, like do all that, could get to the heart and all that. Well, I mean, when you talk skin infection, sometimes like it's trivial, it's one, I don't know.
People tend to just push things off. You have maybe a fungal infection, maybe athlete's foot, in between the toes and all those things. You don't take them seriously. But once a bacteria enters in there, then it can cause cellulitis. If you don't take it seriously, then before you realize, the whole foot is swollen, you can't walk, blisters all over.
Okay. All right. Tell me about how to prevent future episodes, and what signs should prompt me to actually seek medical attention.
So let's talk about the prevention. So you have to take good care of your skin, and especially when you have any wounds, any pricks or anything. The moment you get like a small injury, you are walking through a bush and then maybe something scratches you and all those things, you have to wash that area well with soap, ideally antibacterial soap, but you can just use soap.
Okay.
Maybe get antibacterial ointment to just cover the area, or maybe use a plaster, something to cover it to the barrier so that the dirt doesn't enter into the wound. Yeah. And just watch out for signs of infection. If you notice maybe this area is swollen and all those things, don't just take it for granted. Keep an eye on it. And in case the swelling is getting bigger, the pain is getting worse, or you are developing tenderness, or you are starting to see fever and those things, then you have to get to the hospital and then seek treatment.
Okay.
And I want to talk about people with diabetes and poor circulation.
All right.
Those who are always getting swelling in their feet if they sit for long and all those things, they might be at a higher risk of developing cellulitis. So they have to be checking their feet, especially the diabetes, because they lose sensation of pain. So even if they get a prick, they don't notice they have a prick. So from time to time, if you have diabetes, be looking, let your relative examine your feet to see if there's any sores, any corns, anything that might be an area where the bacteria can enter.
Okay.
Keep your skin moisturized. If it's too dry, it can easily break, and then you get the infection from there. Trimming your fingernails so that you don't use your fingernails to cause a breakage, and promptly treating any infections that you have, any skin condition you have. Please seek treatment early, because the bacteria can superimpose on maybe a skin condition that you have which you are not treating.
Yeah. I was going to talk about some home care tips, but I would want to know, is it related to any lifestyle? So are there any lifestyle changes that you would have to go through if you want to prevent cellulitis?
Not necessarily. If you are immunocompromised, or if you have a disease condition already, then you know that you have to take good care of yourself. But if you are really healthy and you don't have any issues, you don't really need to change anything. Just be vigilant and don't ignore certain pains and stuff like that. And if you have a swelling, don't squeeze it, don't puncture it with a pin,
which we love to do.
Yes.
you know at the initial stage there's a sweet pain sensation when you squeeze.
No, when you squeeze and it opens up, that means you are opening the way for the bacteria to enter. So even if the blister is there, don't break it. But
sometimes they say when you break it, it heals faster. I don't know. Is it a myth?
Well,
that's what we knew growing up, that when you have a blister or a boil or something, you need to sort of squeeze it out so that it heals faster.
Well, if it's a burn, it depends on the severity of the burn. So I can't make a general statement.
Okay.
But in general, just don't break that layer, because that layer is protecting from outside infection coming in.
Okay.
So it's best to just keep it intact and then go to the hospital.
Okay. We're talking about cellulitis. I've got a couple of questions to ask before we wrap it up. This is Hello Doc on PLUZZ 89.9 FM. We have Dr Emefa Dzide with us for today's activity. So, if one gets cellulitis and maybe goes through the treatment regime, gets better, can that person get another episode?
Oh, yes. It depends on what you are doing and things that happen. So, yeah, anybody can get cellulitis anytime. But if you are immunocompromised, that means the least thing you can develop, because the body has immune system to battle this. That's why I didn't say immediately you see a swelling, go to the hospital. Your body can actually beat down some of these infections. So you just give it time. If after 2 days it's still painful or it's getting worse and all that, then you go to the hospital. Other than that, your body's immune system should be able to break it.
Okay. Yeah. Okay. Now, if someone is undergoing treatment, right? How do you monitor the progress of the treatment?
Well, once the person is on medication, especially if it's outpatient oral medications, you don't really need to do much. But if it's a more severe infection, we might want to do some lab tests, full blood count. We want to see the bacteria, the level in the blood and all that. We might do what we call culture and sensitivity to try and identify the specific organism and what kind of antibiotic will be best suited. That usually occurs when it's a very severe infection, or the person has already started some antibiotic and the treatment, the cellulitis is not going.
Okay, something to wrap up cellulitis. I've got one question from a listener that I would ask you, not on cellulitis. So anything to wrap up with cellulitis?
Just take good care of your skin, take good care of yourself, and in case you see something that worries you, go to the hospital. At least if you more than 2 days, the pain is still there, the swelling is still there, visit the hospital and then get some treatment.
Okay, so this question here says, my wife was admitted at the hospital some weeks ago. After we left, she's been complaining of a swollen vein which pains her sometimes. I asked and she told me when they pricked her, they removed and pricked another vein. It's been there for a while now. What do we do? Anything on that?
Well, it depends on a few things. I would have to actually see. We have what we call phlebitis. That's inflammation of the vein. Sometimes it's a bacterial infection. Sometimes it's just the reaction to the trauma that has occurred there. So it depends on if after the discharge she was on some antibiotics and all that. So we can't really tell. But if the pain is still persisting or is getting worse, she should come back to the hospital and then we'll look at things better. Yeah.
Okay, thank you very much, Dr. Emefa Dzide, Senior Medical Officer at the AreaGang Municipal Hospital, joining us Mondays 2:45 for Hello Doc. Thank you very much for coming on.
Thank you.
All right, and you have a lovely week. This is the drive with the AreaGang on PLUZZ 89.9 FM. We just hit the top of the hour, 3 p.m.